How do you give bolus insulin to a child with type 1 diabetes? Imagine your child's blood sugar levels rising after a meal, just like a balloon filling with air. To keep things balanced, parents and caregivers give a special dose of insulin called bolus insulin. This type of insulin is fast-acting and helps lower blood sugar spikes that happen around mealtime. Usually, it starts working within 5 to 15 minutes, so timing is important. The goal is to match the insulin's effect with the rise in blood sugar after eating. Most often, bolus insulin is given right before a meal, about 15 to 20 minutes beforehand. This allows the insulin to start lowering blood sugar as the food is being digested. But with young children, especially babies and toddlers who might not eat exactly as planned or who have unpredictable eating habits, it can be better to give the insulin right after they finish eating. This way, the insulin dose matches the actual amount of food they ate, reducing the risk of blood sugar going too low or too high. The amount of insulin given depends on several factors. Carbohydrate counting is key. Parents or caregivers figure out how many grams of carbs the child plans to eat. For example, if the child's insulin to carbohydrate ratio is 1 unit of insulin for every 10 grams of carbs, and the meal has 30 grams, then 3 units of insulin are given. Blood glucose levels before the meal also matter. If the blood sugar is higher than the target, a correction dose can be added. This correction dose is calculated based on how much 1 unit of insulin is expected to lower blood sugar, known as the insulin sensitivity factor. Caregivers often use these calculations to determine the right dose. For instance, if the child's blood sugar is elevated, a small correction dose might be given, but usually not more than 0.1 units per kilogram of body weight. Sometimes, if blood sugar remains high after the meal, a second correction dose can be given after a couple of hours. Monitoring blood glucose closely is essential. Many children use continuous glucose monitors, which provide real-time data and help guide insulin doses. This way, parents can see how the insulin is working and make adjustments if needed. In summary, giving bolus insulin to a child with type 1 diabetes involves giving rapid-acting insulin just before or sometimes after meals, based on the child's needs. The dose is carefully calculated from carbohydrate intake, current blood sugar, and how sensitive the child is to insulin. Regular monitoring helps keep blood sugar levels safe and stable. Always remember, managing insulin should be done with guidance from a healthcare team specialized in pediatric diabetes to ensure safety and proper control.